When dealing with the stress of calling for an emergency ambulance, some people may already be coping with day-to-day difficulties in communication. One group of people who may be hard to understand are those who've had head and neck surgery in the form of a laryngectomy. Laryngectomy patients have lost their vocal cords, and their restored speech can sound unfamiliar.
My method of communication involves the use of the artificial larynx.
I am speaking with a valve, sometimes called a voice prosthesis.
It's always possible that the medical emergency that triggered the call has disturbed the caller's usual means of voice production. For the next few minutes, we'll be focusing on how best to understand and to help people in these difficult circumstances.
A laryngectomy operation is usually carried out for cancer of the larynx in those patients where radiotherapy has not worked or is not suitable. In this operation, the larynx is removed and the gullet or pharynx has to be repaired as a tube for swallowing. This means that after the operation, the airway is completely separated from the swallowing mechanism, and the patient has a permanent tracheostomy to breathe through. And the lower airway has been separated completely from the upper airway.
After somebody has had a laryngectomy, they only have one tube from their mouth going all the way down to their stomach. Their airway is permanently brought out at the base of their neck in what is known as a tracheostoma. That is their trachea, and that goes down towards the lungs. Thereafter, there is one tube to the stomach from the mouth and one tube from the stoma down into the lungs. The only time the two connect is when the patient has a voice prosthesis or a speaking valve. A puncture is made at the back of the stoma to make what is known as a tracheoesophageal fistula. The voice prosthesis or valve sits in this fistula and connects the two to enable speech to happen after laryngectomy.
I am speaking with a valve.
In many parts of the country, a registration scheme is in operation which helps to identify these patients from the initial telephone call, even if they're completely unable to speak.
Operator. Hello, ambulance service. Okay, try and stay calm. Where would you like the ambulance to come to?
The patients, once they've been in hospital, receive a pack when they're discharged home, and within that pack we've created a form that they can fill in. They put their name, address, details on it, telephone number, all that kind of stuff, and we register those details within the system, within command and control, which means that when they phone 999, the system recognises that telephone number and brings up the patient's name, address, and that whether they're a tracheostomy patient or a laryngectomy patient, and that appears on the screen, which makes it quicker for the patient and quicker for us to identify who they are.
Right, the system is telling me that this is a laryngectomy patient, is that correct?
Obviously if the patient's outside of the home, then we're not going to have those details. It only works if they telephone us from the home address. But hopefully there'll be somebody with them, either a carer or a member of family, who will be able to give us details about the patient's condition, whether it be tracheostomy or laryngectomy.
The ambulance will be with you very soon. I'm going to talk you through what you need to do, okay?
As well as possible communication difficulties,
Do you know how to
the
put
other
someone in
vital
a
consideration
position?
is that there's no point in applying air or oxygen to the nose or mouth of someone who's had a laryngectomy, as these are no longer connected to the lungs. It's essential that oxygen is applied to the stoma. For a first aider, that means mouth-to-neck resuscitation is the only effective technique. Of course, it's a good idea to use any available means of separating yourself from the patient.
Well, I'm hoping for a quieter day today, actually. Oh, here we go again. "56 Rose Gardens." Yeah, I know where that is.
The fact that the patient is a registered laryngectomy means that the controller can inform the paramedics en route to the emergency.
Pallion 337 from Red Base, over.
Pallion 337 receiving, go ahead, over.
Fire on from information the patient you're travelling to has been picked up on our computer, registered with the Laryngectomy scheme.
Pallion 337, that's received. Thanks for the update, over.
Thanks, Pallion 337. Red base out.
It's great that there's a registration scheme for laryngectomy patients, but it doesn't always work, so that's why we do the same survey on every patient.
The paramedic, if the patient was outside of the home, would do a check on the patient when they came across them, and that's checking for vital signs, pulse, breathing, and while they were doing that check they would actually come across the stoma, and that is one of the checks that they do, where they expose the chest and the neck to check for breathing sounds.
Hi, are you a carer?
Yes.
What's happened?
She's collapsed.
Because a paramedic can never assume that a laryngectomy will show up on the system,
Molly?
it's essential that they make it common practice to check the neck and chest area of any patient in case there's a stoma present.
Okay, would you mind getting us a little tea towel or something,
No
mate,
problem.
if you don't mind, yeah?
What have we got, Mark?
Right, she's a neck breather. No, I think there's something stuck inside her neck here.
Right.
You got that tea towel, mate? That's great, thanks very much. Has your wife got any other medical problems, asthma, diabetes?
Raising the shoulders
Or
allows the head
like
to
that?
roll back, giving better access to the stoma in the neck.
Okay, she's got a little blockage in here, I'm just going to remove it. Okay, that's that. Oh, she's not breathing, Jeff, I'm going to have to bag her.
There you go, mate. I'll get a chair.
Okay, cheers, mate.
When a paramedic's resuscitating a patient with a bag valve mask, they could use a paediatric mask, a circular mask that comes in different sizes. Alternatively, they could use an adult mask, which they just need to turn to the side so they can occlude the stoma and cover the neck with that.
Hello there. How are you doing? You remember what's happened to you?
When a paramedic resuscitates a
No.
laryngectomy or tracheostomy
Well,
patient,
alright.
all the dressing should be removed from the neck. The stoma or tracheostomy tube should be completely exposed, and resuscitation should take place via the tracheostomy with closure of the mouth and nose.
Some outer covers may look just like clothing. It's only once these have been removed that you can see any other covers, and finally reveal the stoma itself.
Through.
We have to make sure that we place 2 fingers either side of the patient's nose and the palm of the hand or your thumb on the patient's chin to keep both airways closed. You have to make sure you do that in case the air escapes anyway.
It's important to occlude the mouth and nose because in tracheostomy patients they still have a pathway from the mouth and nose into the lungs.
Now, Molly, if you stand up with me, Flower, okay, and just sit on me. Ready? Up and over. That's it.
That's it.
Go back, point ahead. Lift your legs up.
If there is no laryngectomy mask in the ambulance, a paediatric mask can be used, or alternatively, a regular mask can be used by rotating it 90 degrees before placing it over the airway.
Just want to put that oxygen back on there, Molly. All right, that's it.
Any other protocols not associated with the airway, such as the use of the defibrillator and the administration of drugs used in emergency resuscitation, may be carried out as with a normal patient.
Just going to go tight around your arm to see your blood pressure being taken, okay?
Casbase 048, can you be standing by for a female patient who has collapsed? She is a laryngectomy patient. ETA 5 minutes.
You all right there? Yeah? Has anything like this ever happened before?
Why, maybe a couple of months ago,
Uh-huh.
he had trouble with the valve.
Same sort of thing? Yeah.
Yeah.
It's vital that the paramedic listens to the carer carefully,
Right.
as they will undoubtedly have some specialist knowledge of the
Alright,
patient's
we'll get it
medical
sorted.
condition.
Did he call an ambulance out the last time?
No, I whipped her up in the car.
Did you?
Yeah.
You've done the right thing by phoning an ambulance this time then, eh?
An important thing to remember is if a laryngectomy patient cannot breathe easily, they may be panicking and they may not be able to communicate as effectively as normal. Always make sure you consult any carers because they may be able to help you and give you some advice. They may also be able to interpret what the patient is saying because they may be able to lip read much better than you. They've had plenty of practice over the years.
It's difficult, we get so few of these jobs, but you have to check for a stoma. It only takes a second, and you must treat that as the main airway.
And remember to block the nose and mouth, because if the patient is a tracheostomy patient, there may be some airway left and air can escape from there.
Paramedics may find that laryngectomy patients have 4 different types of voice. The most common type of voice in the UK is for a patient to have a voice prosthesis or a speaking valve.
I am speaking with a valve, sometimes called a voice prosthesis.
This is a small silicone valve that fits at the back of the stoma, and it connects the trachea with the esophagus in what's known as a tracheoesophageal fistula. When the patient wants to speak, they put their thumb or their finger up to their stoma and block it with their thumb. The air then passes through the valve and into the esophagus. As the air passes through the esophagus and up through the mouth, they vibrate what is known as their pharyngoesophageal segment to make voice.
I am speaking with a valve.
The second type of speech the paramedics may find is the patient has esophageal voice.
Esophageal voice.
The patient learns to push air from their mouth down into their esophagus and back up again, quite similar to a belching sound, to produce voice.
When I attained esophageal voice, which I'm using now, it was one of the most satisfying moments in my life.
As the air passes up, it vibrates this pharyngoesophageal segment to make a voice. This voice is not as loud or as fluent as a valve voice. The third type of voice the paramedics may encounter is a electronic larynx, sometimes called a Servox. That's a brand name, the most commonly used in the UK.
My method of communication is by using the artificial larynx.
To speak with this, the patient will have a small mechanical vibrating device they put against the side of their neck.
This is my voice.
This gives an electronic sounding voice as the electronic tone passes from the device through the tissues and into the mouth, where they shape it into speech.
My method of communication is by the use of the artificial larynx. This one has a trade name of the Servox.
The fourth type of speech they may find is a patient is just silently articulating. I would imagine this is the most common type of speech they may find if somebody is in a very difficult, distressing medical emergency, because the patient may no longer be able to produce their valve speech or their esophageal voice, or they may not be able to find their electronic device very readily. So that's something that they may need to watch out for. They should watch the patient's lips very carefully. They may want to ask the patient to write something down with a pen and paper. That might be a good idea as well. But please bear in mind that quite a lot of people in the UK are not that good at reading and writing. It's possible that might be something they've not been used to doing. So just bear in mind, not everybody is literate.
Molly's husband Alf was really worried what would have happened if he hadn't have been there.
I explained to Alf that we do the same survey on every patient. So even without the registration system, we still would have found the stoma. And we're all trained to recognise the different ways that laryngectomies speak.
If there's any complication or uncertainty, the head and neck unit will be able to answer any questions. But if the carer is present, they will be the most important source of information, as not all hospitals with an A&E department have a head and neck unit. For any paramedic or first aider dealing with someone who's had a laryngectomy, there are some vital points to remember. First, check to see if the patient has a stoma. Wipe away any mucus or crusting that could be blocking the stoma. Check the stoma for blockage and for signs of breathing. Raising the shoulders will tilt the head back, giving much better access to the stoma. Remember that the small plastic valve, which is often present in the wall of the trachea, is meant to be there and should not be removed unless it's causing a blockage. It's vital that the upper airway is closed, whether the patient is a tracheostomy or a laryngectomy. This is to prevent air escaping if there's some connection left to the upper airway, as can be the case in a tracheostomy. Oxygen or air must always be applied to the stoma, the opening in the neck. If there is no specialist mask available, a pediatric mask can be used, or a regular mask turned through 90 degrees.
Film finished?
Yeah, it's just finished.
And always listen to the carer or relatives. They will be your most important source of information about the patient.
His mind. If Got to rest for 2 or 3 days.